Today, I want to talk about big data in healthcare. First of all, what is big data? It is a very large amount of information that comes from many different sources. For example, it can come from electronic health records, medical devices, lab test results, and even pupils' genetic data. This kind of data is very big and complex, so we need special technology to collect, store, and understand it. In the past, doctors could only use a small amount of information to make decisions, but today with big data, we can study many details at the same time and find useful patterns. This helps doctors understand health problems better and faster. However, with great power comes great responsibility. Using big data in healthcare also brings serious concerns, especially when we talk about risks and ethics.
Major risks of using big data in healthcare. One of the most serious risks is data security. Medical information is incredibly sensitive. If it is hacked or leaked, such as data about a patient's HIV status or mental health, it can have devastating consequences for that person's privacy and well-being. Another major concern is errors in data analysis. If the data is incomplete, biased, or incorrect, it can lead to wrong diagnosis or inappropriate treatments. In such cases, instead of helping, big data can actually cause harm. In addition, there is the risk of over-reliance on artificial intelligence. When doctors depend too heavily on algorithms and overlook their own clinical judgment, we will lose the human element, which is fundamental to the practice of medicine.
The use of big data brings up important ethical questions. First, there's the issue of privacy and informed consent. Many patients are unaware of how their data is collected or used. Informed consent is often just a checkbox, far from the clear, transparent agreement it should be.
Secondly, we face the problem of algorithmic bias and discrimination. If the data used to train AI systems lacks diversity, those systems may work well for some populations and poorly for others. For example, an algorithm designed to detect skin cancer might perform accurately on white skin, but fail to recognize symptoms on darker skin. This can lead to unequal treatment, and that's unacceptable.
And finally, there's a tough question we still haven't answered. Who owns the data? Is it the patient, the hospital, or the tech company analyzing it? This question is at the heart of ongoing debates around data ethics and ownership.